So why don't we go ahead and get started? The first order of business is to approve minutes. The minutes of the September 27th meeting and the minutes of the October 27th meeting. And I didn't see anything in the minutes that required any attention other than the October meeting. We're missing Mary Gavier. She isn't listed there, so I'm just going to correct that. That's all right. Anything else to add? Okay.
Motion to approve as amended.
Thanks, Jim. Can I get a second?
Second.
Okay. Everyone in favor? Okay.
Aye.
Okay, good. All right, well, let's go ahead and move to the main event here. We have David Knopf is here, and it's great to have him give us an update on many things that he's welcome to talk about. We're interested in COVID, of course, but anything else you want to add is terrific. So David, go ahead, and then we do have some questions that were submitted to you, and you could certainly get to those.
Okay, well, as we all know, thank you for inviting me to speak with you. This is continues to be a rapidly evolving situation, just as it has been for for 2 years now. I mean, we started becoming aware of COVID in December of 2019. Here we are. That's why it's COVID-19, right? So anyway, as I was sitting down to get ready for our discussion tonight, I went to the CDC website and saw that as of 3 hours ago, CDC it urges Americans to avoid travel to France and Jordan. An hour ago, Portugal was added to the list, and we'll see where it goes after the night is done. So, it's constantly changing. I'd like to also, move on to talk about what we're doing in town with our clinics now. Back in the spring, we did our first round of COVID vaccinations, and we did 39 clinics and vaccinated 6,100 plus people at that time. As I said, in 39 clinics. That was from January through May. We had the summer off. Things got quiet during the summer, and we'll go over the charts but in a minute. But first, I just want to kind of go to where we are now. We thought that we were going to have a pretty quiet fall. School started without incident. We offered seasonal flu vaccine in October, just as you do customarily. I mentioned the 6,000 doses of vaccine we gave in the spring. Typically, when we do seasonal vaccine, we do a grand total of 350 doses a year. So while we had some experience with doing clinics, we never did anything close to the volume of giving vaccines the way we did in the spring. That was whole new territory for us. And of course, with our staff of 2 full-time people and 2 part-time people, we had to rely a lot on community volunteers. And Mac can attest to that. He's been there helping out lately with our weekend clinics doing the kids. So anyway, we did 4 seasonal dose clinics in October and vaccinated 250 people for seasonal flu in October. And then in November, we began the booster program. And we did 4 clinics in November, and just shy of 600 doses of boosters were issued. And we did 2 first dose clinics for kids on Saturdays in November. And 750 children were vaccinated at those 2 clinics in November. We had our first second dose clinic this past Saturday, and we have our next one scheduled for this coming Saturday. And we will be doing at least that same number again, 750, probably more, because there's some people who missed the first time around that just want to get their first dose in. The good news is that any of the kids who've been vaccinated by this Saturday will be fully vaccinated on Christmas. Fully vaccinated is considered to occur 2 weeks after the second dose. So,
David, if I can just interject, I mean, my wife had been helping check families in, and it really is exciting to see young children come in, scared, nervous, they're clinging. They don't want to be there, and then when they walk out, they're so excited.
We had a lot of concern about how it was going to work out doing pediatric clinics and working with the kids. And the vaccinators have been fabulous. The parents have been great to work with. They've been managing the kids really well. And the kids have been extremely well behaved. We have a couple kids that are a little, as you say, more than squeamish. There are some that are absolutely petrified. But by and large, everybody's been wonderful. We've had some teachers come in to read to the kids while they're spending the 15 minutes after the shot, kind of calming things down a bit. But again, we're relying on volunteers. We have some of the vaccinators are school nurses. I say volunteers. This time around, they're being paid because we were having trouble. We couldn't get unpaid volunteers this fall. So we
Oh wait, you didn't talk to me about pay.
I know, for a reason. We're getting to that. So just the vaccinators, which is, we're trying to get some compensation going for the front desk as well, because we couldn't do it without them, and it's been amazing. The community has really stood up in a fantastic way. So at the end, so far, we've done 51 clinics in 2021 and have done so far issued almost 8,500 doses of vaccine. And as I said previously, our high was in the COVID year. I mean, not COVID, but H1N1. And that year we did somewhere around 450 total doses of vaccine. This is far in excess of anything that we had ever envisioned doing. We weren't sure we were going to do the pediatric clinics this fall, but when the school director of nursing surveyed parents, got an overwhelmingly positive response to wanting to have the kids vaccinated. And so we went ahead with planning our Saturday clinics because we didn't want to interfere with school. We thought about having clinics at the schools, but thought it might be too disruptive. So we kept everything in the town hall gymnasium, which, except for the fact that there wasn't any heat this past Saturday, has worked out very well. I've been assured that will not ever happen again for any further future clinics, but we'll see tomorrow. Are there any questions about and I did want to say also, we have booster clinics scheduled for tomorrow and next Tuesday. And we have the one additional second dose clinic scheduled for this coming Saturday. And at this point, we're going to revisit and figure out what the demand is going to be after the first of the year. That's the last of our planned clinics for the rest of the year at this point. Any questions about where we're at right now? And if not, we can, Lois, if you could bring up the last week's summary. Laura, you got a question?
Can you hear me?
I can hear you now.
What would you say is the percentage of children that are getting vaccinated between like the 5 to 11 versus the 12 to 15?
Yeah, that's in this report.
Oh, Sorry.
No, that's okay. We'll get to it. And let me go through the report. And then if you have any questions at the end of the report, we can try to address them. Next page, Lois. So this is as of last Thursday. And you'll see to the right is November, current month, November. And if you look to the left, you can see November of last year. And you can see that even with the number of cases that we're reporting now, we're still less than we were last November. We are seeing that most of our cases, very definitively, are either in a younger age group, and you'll see that. Next slide, please. Well, this is a weekly summary, and hopefully those numbers will continue to go down. This is from July. We do have the rest of that information in the middle of the graph up above. You can see a link to the June 2021 report, which would be the previous year's summary on a monthly basis. You can see that our numbers went way up, in really in conjunction with Halloween, I think, and gatherings at Halloween. Next slide, please. This is where it's really interesting. The 0 to 11 age group. Now we haven't broken out the 0 to 5 and 5 to 11 age group here yet, because the vaccinations on those, they're still not fully vaccinated. So there's no point in separating that out. They won't be fully vaccinated. We'll probably start breaking that out after the first of the year. But you can see our most of the cases, the highest number of cases is occurring in the 0 to 11-year-olds who were not vaccinated. And in Darien, next slide, please. Positivity rates jumping around, but it's still pretty high. That's based on positive cases relative to the number of tests. Next slide, please. And that's tracking it from the beginning, the positivity rate from the beginning of time. You can see we're approaching last winter's numbers, positivity rate. A lot more testing going on now. People are still getting tested a lot. Scroll, please. And Laura, I think this is where you asked the question about how we're doing with vaccinations. In this slide, first thing I want to point out is that vaccine eligible, if you look to the left, there's a sort of light blue. It says vaccine eligible, 20,309. And of that, 18,806 are partially vaccinated. 92.59% of those eligible for vaccine have at least had one dose. And then to look at that's an incredible number. And again, that's another thing that I think the community should be very proud of, is their vaccination rates and the willingness to do what they can do to protect themselves and their families. If you look, that number, those numbers are from the 24th of November. We have to use the state data, and their data is a little bit behind. But on the 24th of November, on the 5 to 11 age group, you see that there were basically 1,500 kids that were vaccinated partially. That's almost half of that age group. That's incredible. And that is really, I'm not sure how much of our data is in there. We're going to add a considerable number. Plus, that is almost 2 weeks ago. So you're going to see a big difference with this week's summary. And I think you'll be very pleased to see that. But if you just look at those numbers and, again, if the next age group, 12 to 17, oddly, and I've been asked to explain why you have more people who are partially vaccinated than that population. And that's a state number, that's not mine. And so we just take that chart from the state database. And for one reason or another, as you can see, the number partially vaccinated exceeds their census numbers, which are approximate for that age group. And that's pretty consistent, even the next age group, 18 to 24. So, we have really vaccinated pretty much everybody in those age groups. Same thing with over 65. Remarkable success of a vaccine program in town. I'm not just saying it for the health department, because not everybody got vaccinated by our department. That's part of the advantage of, being in an area that has a lot of services. Next slide, please. And, if you go back and forth between these two, you can scroll and see the differences. And as I said, the 5 to 11-year-old age group in Connecticut, 21.2% have received at least one dose. In Darien, it's basically 50%. So I dare say that we are, I think, leading, or among the leaders anyway, in the state for vaccination rates for all eligible age groups. Next slide, please. And this is interesting because you can really get into the weeds with this, but one of the questions that I had received is, are we still doing contact tracing? And we're doing the best that we can to keep up with it. And these are the results of interviews that are being conducted of positive reports every week. So, for example, in the November 24th to December 2nd week, we had 58 positives. Not everybody wants to be interviewed, not everybody answers the phone, and not everybody wants to talk to us, but in general, people have been pretty receptive to providing us with information. And, one of the things that we're really interested in is getting an understanding, not only how many people have been vaccinated, but also what types of symptoms are people having? How sick are they? We're not seeing any hospitalizations and haven't seen anybody hospitalized since April. But, how sick are people? That's one of the fundamental questions and things that we want to understand. And there's one of the columns there, symptoms, and we had 38 yes, 7 no. So those were asymptomatic people who were tested for various reasons, who found out when being tested that they were positive. And of the yeses, the 38 that did say they had symptoms, most were describing, kind of like cold-like symptoms, whether it's stuffy nose, sore throat, fever, feeling lethargic. But at this point, I'm pleased to report that we're not seeing seriously ill folks, even with these increased numbers of cases. You see here, fully vaccinated last week, we had 24 adults who acknowledged that they were fully vaccinated. These are called breakthrough cases. Most of the cases that we're seeing in town are either breakthrough cases or kids that aren't old enough to be fully vaccinated. So if you go back to that chart, that showed the high numbers for the 0 to 11-year-olds, that's that group. And then the rest of the population, as you go to the previous chart that we looked at with vaccination rates, our rates are so high, most people who are testing positive have been fully vaccinated. We really don't have very many folks who aren't. vaccinated. And finally, I think there's one more slide. Yeah, we have the drive-through clinic. We get results from them every day in town, and so they're still busy. They're there every day, which again is a unique service to offer to the community, and that's worked out very well. So with that, I'll take some questions on the charts, and then I'll go over what it is that I received as questions, if that's the format. It's okay. Or one more thing that I'd like, Lois, if you would, to pull up that website that has the state database. And just, if you could, can you scroll down on that, or is that just, is that it, what we can see? You could, there's all kinds, just stop right there. There's all kinds of information. You want to see what's going on in the schools. We're also linked with the schools. We have daily conversations to know what's happening with schools, reviewing potential for quarantining issues and close contact issues, and follow-up questions. And scroll down a little bit more, please. Again, now you can see, stop right there. You can look into testing, numbers of tests, cases, deaths, hospitalizations, all kinds of information. You can have a lot of fun here, mining the data.
And a reminder, David, that we put the link in the chat box, and I think Mac's going to put it out in the minutes also.
Okay, great. Thanks, Lois.
David, can I ask a question?
Who's that, Jim? Is that
Jim
you?
Cameron.
Jim Cameron, of course.
Thank you. Jim Cameron, District 4. You mentioned the breakthrough cases as being fully vaccinated. And by that, do you mean 2 shots or also a booster? In other words, are we seeing that the booster is preventing infection any better than the first or the second shots? Thanks.
Boosters have just recently been administered, so we don't have any data on that yet. We just started giving them in November, and that's really nationally, that's been pretty much it. There was that group that were considered to be highest at risk, where there were booster shots being given in August, but they were pretty limited at that time. So to answer your question, the definition of fully vaccinated stands at 2 shots and 2 weeks after you receive your second shot. The definition has not been modified to include a requirement that boosters be considered a part of being fully vaccinated, at least not yet. That could change tonight. I don't know.
Can I ask one other quick follow-up?
Yeah.
I saw from the chart that the first shot statistics are quite high, but there are still people who have not had their second shot. And I'm wondering if you're waiting for them to come in, or is the town health department doing any outreach to those people who have not had their second shot, let alone a booster? Thanks.
We're relying again on state data for that. We have found inconsistencies with what they're reporting as people not having their second shots and what we know to be the case. For example, I was on the list of not having had my second shot. And I can assure you that I did. So, the database isn't perfect. Are we tracking down people that are on that list? Jim, if we had the time to do that, we probably would. But at this point, we're so busy trying to meet the demand of those who want to be vaccinated. And if somebody chooses not to get their second dose, there's really no requirement that they do that. Again, our numbers are still so high in town that we should be approaching herd immunity with those numbers anyway. So, but we're not going to, because, we travel a lot, we go to different places. And clearly, the number of breakthrough cases that we're seeing indicates that vaccines are seemingly losing some effectiveness over time. So it's important that we focus on getting boosters to people now. There's a lot of locations other than through the town for people to get booster shots. Our local pharmacies are offering them, and there's clinics in both Stanford and Norwalk operating a lot. So availability is there.
Gotcha. Thanks.
You're welcome. Yeah, Robbie.
Yeah, thanks, David. All this data is great, and thanks for providing it. We can look at it, and it is interesting. My question to you is like, what kind of vibe are you getting? Like, obviously we have more knowledge and more tools and something than we had a year ago. But like, just you, not as a medical professional, as just a guy, Christmas coming up, how freaked out are you? Less freaked out than last year? Do you feel positive? I mean, just your general, how worried should we be?
It's a loaded question.
No, I don't mean it to be loaded.
I know. So anyway, I'm not freaked out. I'm disappointed in the numbers, and the numbers being that they're going up. But I have to tell you, I'm very encouraged over the fact that as a result of our interviews, we're finding that people are not terribly sick. I keep hearing this COVID being referred to recently as a disease. I have to think, that seems to be a bit of a stretch. I mean, is a cold a disease? Is the common flu a disease? I don't know, and so I'm not sure I agree with that approach that's being taken by some of our national experts when they're talking about COVID at this point. So no, I'm not freaked out, but I do get concerned over the trajectory of this and how policies emanating from above may be adjusted in response to ever increasing numbers. Last thing I think any of us want to see is any form of a lockdown, or whatever it is, where we aren't going to school anymore and, can't go to the restaurants. And there was a question that I was asked about, will we do mandated anything with respect to businesses in town? And the answer is no, I don't see. Darien never adopted mandated masking requirements as a community in public, and I don't see us doing that unless we start seeing hospitalizations and people getting very sick.
Or you're at the town hall.
Well, at the town hall, that's a different matter too.
Well, it's a mandate. It's fine. I wear it everywhere, so I don't care.
Yeah.
Well, my other question is kind of for you and for Matt. Matt, do we have any money? Like, can we just ask for, $25,000 in Darien gift cards to give to David that he can dole out to his volunteers as he sees fit? I'm serious. I mean, do we have that kind of money? Can we make a request? Not that anyone's going to back me up on this, but
I don't know. I think that would come from the selectmen. I don't think we would be doing that, but I'm certainly if you want me to take it further, I could look into it.
I would vote for it. I mean, I just think you have all these people. Obviously, David's been telling us that have really stepped up and made this all possible, and I think we're an affluent town and we can be generous.
Yeah, I think it's kind of a slippery slope when you start talking about compensating people that choose to volunteer. I think we do a good job as a community with the volunteer model.
Yeah, no, and that's why I like the gift cards, because that boosts town businesses a little bit, and that's why I don't want to have anything to do with it. I think David's on site and he can decide, and I think he can also get a sense for who might need it.
Yeah, that's also something for social services maybe to get involved with. So anyway, it's a
So
good
the answer is
point.
no. I
Um,
tried.
I will say it's interesting that you should ask that question because I asked that very question today to see about getting a gift certificates to our unpaid volunteers, and the request was denied. So I mean, if you know, I was a little surprised to see that. You know, it's, you know, these, as I said, we've done 51 clinics so far, and we have 3 more to go. And we have a cadre of folks who've been out there making this happen, volunteering their time, not getting paid, you know, just doing it because this is what they feel they want to do for the community. And I wasn't looking to, you know, add them to payroll or anything like that. But I thought that it could also be an incentive to our local businesses who've also struggled during the COVID times to have, you know, a $50 gift certificate or something like that. It's not a lot of money, you know, and, you know, maybe there's 30 people who this would apply to at most, you know, I think, I don't know.
Geez, I was about to up you to $50,000.
But, you know, I mean, it's small expense for the value that these folks have contributed to our community. So, you know, it's funny, like I said, I raised that, I posed that question today, especially with the holidays coming. You know, I thought that it would be an appropriate thing to do.
Apparently, we don't have any money.
I think it's a slippery slope because you also have 3 fire departments that are all volunteer too. So why would you not give them something?
Well, we do give them quite a lot, actually.
Oh, really? You give them what? What do you give them?
There is an allocation to the fire department.
To the fire department, not to individuals. And
Yeah.
not to take
I
anything
just
away
don't buy
from volunteers,
slope
but the
arguments.
point
If you
is,
want to make the
the
argument,
town runs on volunteers.
then let's give some money to the firemen.
Let's
I
table
don't-
this. Let's
Well,
move on because
argument.
David's got things to cover here. He's got
You're right.
questions that people
You're
submitted. So why don't you go ahead, David, with that?
Okay. One question that I received: if you have no symptoms and have been vaccinated, when and why should you test for COVID? Really, you should be tested for COVID if you've been exposed to a positive case. That's the whole point of contact tracing, is that we let people know if they've been in touch or in close contact with somebody who's positive. And so we're saying 5 days after exposure is an ideal time to be tested to see if you're positive. But it really has to do it's if you have no symptoms. It's after 5 days after exposure. Another question was, are the over-the-counter at-home tests accurate? Well, they're approved by FDA, so they had to submit those tests for some kind of oversight, so they're considered to be accurate enough. We don't use them to determine whether or not a person has, you know, we're not really reviewing them, and those reports aren't submitted to the state. Nobody really knows the results of an at-home test except for the person who's taking the test. And if they do take the test, who do they report to? Well, they should report it to their employer. That's primarily where they should be reporting it to, wherever they work, to their HR department. Do they report to the health department? We would suggest that anybody who gets a positive at-home test get tested at a standalone facility, get a PCR test, get a second opinion as a professional test. And And finally, is anyone still doing contact tracing? Yep, we're doing the best we can. I know that under these circumstances, with these kind of numbers, it gets to be trying, but we think it's still important. We want to understand what's happening in the community, and we also want to give guidance to people. I'm afraid that sometimes people don't quite understand what quarantine means. And if you're a direct contact and you're quarantined, that means not only do you not go to school, but you don't go play sports. You don't go out. You really are supposed to be isolating yourself from others. We're finding that there's some disconnect in some cases between what people think a quarantine is and what they actually do. So they need to, and that's part of our interview process, and that's part of our contact tracing, is to go over, how people are supposed to be modifying their lives and for how long. I think that's Jim. That's your questions. Laura, you sent me some questions as well. At this point, number one question had to do with mandating mask wearing. While we're doing it in town hall, I don't see us doing it actually in town facilities, town hall, and the schools. I don't see us extending that to require it to any businesses. We didn't do it the last time through. I don't see us doing it now. Again, unless we start seeing hospitalizations going through, starting to occur again and people getting really sick, which is the key to our interviews. I don't see us doing any mask mandates. Plus, we're getting vaccinated. Plus, there's boosters. So we're in a much better place than we were a year ago. Second question had to do with percentage of children in Darien being vaccinated. We went over that. That's in the weekly chart. I don't think we need to launch a campaign, to be vaccinated. Our numbers are so high, refreshingly high, and that's not the same throughout Connecticut. We are leaders in our vaccination rates in Connecticut. I'm proud to say that. You asked a question about antibody levels, and the state health department still isn't advocating doing testing for antibody levels, even though from a scientific perspective, you might say antibody levels would be the measure that one would use to determine when it's time to get your booster. But I think that it has to do with the availability, widespread availability of antibody testing. Certainly as an individual, if you want to get that done and use that as your measure to determine whether or not you want that booster and when, it makes sense. I mean, it's a logical thing to do, but it's just not going to happen because that's an expense and a resource that is not as widely available. Another question had to do with dosage for children, and if parents choose to give their child one dose, will the school mandate a second? The school hasn't mandated vaccines at all. And again, our success rate in vaccinations don't indicate the need to mandate. And their success with masks wearing through the schools is also really good. We're not seeing transmission occurring in schools directly through our interviews. For the most part, we're seeing transmission occurring related to at-home activities, family transmission. Our data is showing that when one person gets it, pretty much everyone in the household gets it. And when you have those sleepovers and get-togethers with the kids, that's another fundamental method of transmission. There's a lot of attention that has been given to sports and control of interactions in sports. And interestingly enough, we're not seeing a lot of transmission occurring in the process of the games. It's the associated social aspect of sports that includes carpooling and before and after get-togethers with the kids and parents and stuff. So it's not so much the sporting activities themselves, but it's the social engagements associated with them. Couple other questions you had. As far as policy questions with comparing what we're doing here in the United States or in Connecticut with other countries, I don't know that. You asked the question, have we considered one dose as being fully vaccinated? Johnson & Johnson was the one and done vaccine, and but the other two weren't. And that's basically not a designation that was arrived at by CDC or the governments. That was by the manufacturers themselves. And FDA and CDC approved their application for 2 doses for Pfizer and Moderna in this country, which are still the only 2, and Johnson & Johnson 3 in this country approved. But Johnson & Johnson was the other one, and that's the one and done.
The reason I asked the question is that, my kids I have twin boys and they just turned 12, but a month ago, they would have been given a total of 20 micrograms, and now they're getting 60. And I'm thinking, well, 30 is 50% more than 20. And that's just like, I just don't understand how, and I don't know if, you're certainly not like a medical, these are clinical trials. I don't know why they decided to just, take this age group, 12 to 15, and give them the same dose as an adult. And I don't even think that there was any clinical trials done for what if one dose was effective enough. So
Laura, I had the same question, and I had a problem with that because I don't feel that my daughter, who's 95 pounds, should get the same amount as my, husband, who's a big guy. I don't know, I agree. It's like, most medicines with kids are based on weight, not age, right? So
when I spoke to
yeah.
doctors, they said they're not doing it by weight or size, they're doing it by the immune system. And I'm actually, if I find, this is a long shot and everybody's going to laugh, but I actually found out who the senior vice president in charge of the vaccine development at Pfizer, and I left her a voicemail message. And I'm going to follow up with her again. And I also reached out to the FDA because they basically received a report, and they're, either they're going to approve it or I don't know what their process is, but they're basically, I don't know if they're going to question what's the effectiveness of one dose for a child of this age. Because I explained to them that there was no, according to Pfizer, and they have they actually have a person answering questions. And they said there didn't seem to be any clinical trials for what, they basically followed it up like the adults 3 weeks later for that child. And I guess since there was no side effects, but I feel like there's missing information. The woman that is in charge of vaccine development is incredibly accomplished and also has subspecialty on vaccines for children, for infants. So I feel like that person is extremely highly regarded, and there has to be a reason. So I'm trying to figure out what this
Laura, thanks. I'm not sure David's here to give you that answer, unfortunately.
Got it.
But I can add to that. I can add to that because we've been asked that question. And what we do, because we've had some parents be concerned over the size, a child of, smaller child or larger child, didn't fit into the age category, but their physiology and their size kind of made them either seem like they should be older, considered to be older. And we just refer everybody to talk to their physician. And if the physician wants to authorize something that's outside the boundaries of what's being established by any of the vaccine manufacturers, then we'll consider that. And actually, we've run a couple of those by the state health department because, I agree, there's an awful lot of unknowns here. And, it seems arbitrary to pick a number, a number, and an age, not a weight, not, say, if you picked a number, an age associated with a weight, perhaps, that's one way. But, this whole thing has been complicated from the beginning, and it hasn't gotten any less complicated as time has gone on. Go figure.
Thank you so much. I appreciate it. And thanks, Holly, for your input.
Yeah, you're welcome.
Absolutely.
I don't think I have any other written questions, so I don't know if anybody else has any other questions for me at this point.
No, David, just thank you for making time to be with us. I think it was really good, and of course this is being recorded. It'll be available on the web for anybody to look at. So I think that's really good.
Good. Well, I appreciate having the opportunity to speak with you. And I'm hoping that the next time we do speak, it's going to be to say this is in our rearview mirror, right? So anyway, thanks everybody, and I guess I'll say good night.
Thank you, David.
Thank
Rock
you.
on.
Good holiday. Thank you.
Thank you.
Okay.
Bye now.
Well, I don't have anything else. I do have a question. I see one person who's not doesn't have the video on. Raga Justin. Who might that be? You see that, Lois?
Hi. My name is Raga. I'm a reporter with the Darien Times. So I'm just sitting in today. Thank you.
Well, thank you. Thanks for joining us.
Thanks.
I'm just going to open up the chat. So everybody, I don't know, I guess everybody has to open up their own, but just to have the link, I think it's really helpful. And maybe, maybe it'll show up on the recording. That's why I was trying to do it.
Right. I definitely will put that in the minutes. Well, thanks everyone. I thought that was a good meeting. Can I have a motion to adjourn?
Move to adjourn.
Okay, second.
Second.
Okay, all in
Thank
favor?
you, Mr. Chairman.
Thank you.
Okay.
Have a good holiday, everybody.
Bye-bye.
Yeah,
Thank
have
you.
a great holiday.
Nice 10-minute break, and then we start up again.